Hi, good morning, good afternoon, and good evening. My name is Jill Litt, and I'm from the University of Colorado Boulder and the Barcelona Institute for Global Health. I'm pleased to be a part of the Planetary Health Conference, and I'll be talking about nature-based social prescribing and the connection to loneliness and mental well-being. To start, I want to just give a definition of loneliness, the way in which we are defining it. And it refers to the feelings of being alone and not connected to others. It can occur in large groups of people. It gets at the discrepancy between actual and desired social relationship. Community-based intervention that could promote belongingness and embeddedness in community would be an intervention that addresses loneliness. COVID and the confinement issues have placed the issue of loneliness at the forefront of communities worldwide. The stay-at-home mandates have been our teacher in highlighting the importance of being outdoors for health and well-being, and the nature-based interventions can be an antidote to loneliness. There was an article in The Lancet in 2010 that really highlights to me this growing trend and awareness of loneliness. The physician reported a visit by one of her patients who had no desire to return to home, where she had lived her days in isolation. And the patient asked the doctor if there was a cure for loneliness. The doctor wished she could just prescribe antidepressants and then she would have done her job. But she also recognized that this patient didn't need antidepressants, that she wasn't clinically depressed, but she had been left behind by a world that no longer revolved around her, not even the littlest bit. This story of being unseen, of no longer feeling a part of something, is something that doesn't just affect older people. It affects people across the lifespan. It affects people across different social groups. It affects people across different kinds of communities all across the world. It doesn't know any boundaries. There is a need to really think about, what do we do to address this? Our health systems are cracking under the pressure of so many different ailments. Loneliness is now recognized as another reason why people are showing up at their doctor's offices. There really is a need to figure out solutions that fall outside the healthcare system, or at least in alignment with the healthcare system. Because this is a conference that really emphasizes interdisciplinarity and working across different groups, practices, policy, research, this is a story that really exemplifies that. And it's been a journey for over 20 years, figuring out how to make these connections across disciplines to answer really hard questions. I started in Baltimore at Johns Hopkins University. I did my PhD there. And when I was there, I really was focusing on land use, and I was focusing on the cleanup of toxic land. What became abundantly clear to me was that it wasn't just about the industrial land. It was also about where people live, these residential environments that weren't really part of the environmental health equation at the time. And this quote that I came across while I was finishing up my dissertation, basically said that the decline in community health is an inevitable outcome of the collapse of place. And this was collapsed. Neighborhoods all over Baltimore were neglected, forgotten, people were sick. And it wasn't cancer risk and long-term exposure to toxics. It was about everyday living and how to survive. Then when I went to Boston, having worked on the cleanup side, I was now introduced to what happens when you redevelop land for community purposes. And it was an aha moment. I went to a Boston Food Project lunch, which changed my life. It was one of the most remarkable experiences. And in 1 hour, all of the ideas that I had been accumulating in Baltimore really came to just brightened as I had this chance to meet young people who were coming together to grow food on local land. This was in about the year 2000, 2001. So they were really ahead of the curve in thinking about how to engage people around the land where they live. It was a farm to table program. Before that was a fancy thing to say. It was for all people, and it was fueled by young people who were providing this leadership and providing a tremendous sense of belonging and joy and pride in the food that they produced, the people that they shared it with, and the stories that they got to tell about these experiences. I took that with me as I went to Denver, Colorado, and I was promptly introduced to the director of Denver Urban Gardens, who asked me, could you help us evaluate our system of gardens? At the time, there were 43 of them. Today, there's over 180. And I didn't really know quite how to do it, but I agreed to it because I thought this is something that's super compelling and challenging. And we set out to understand whether gardens were effective as a nature-based social health intervention. And if so, How? What we found in our body of work, which was cross-sectional studies, observational studies, and most recently a randomized controlled trial, we found that there were three crucial things going on in the garden context. One was that it was very tactile. People didn't garden because they wanted to be super fit. They gardened because they liked to get their hands dirty. So there wasn't this health driver that brought people to the garden. They also gardened because it made them feel good. Light bulb. This was about mental health. Even though we didn't approach it with mental health in mind, we began to see that this had tremendous emotional health benefits, which are vital for mental well-being. And then the last part of it was the social, that they garden to connect with others. None of this fits in public health per se in the most traditional sense. It was still health. It wasn't health in your face. It was health because it was so natural. It was the way people engage with the landscape. We've taken this information and we realize that gardens may not be for everyone, but there are some tacit things about it that can be replicated in other kinds of interventions. So in our work in Barcelona, Spain, we are spanning the work of gardens, using that to inform a new project that's focused on nature-based social prescribing. The project is called Reset This. It's funded by the European Commission, and it is about reimagining environments for connection and engagement, testing actions for social prescribing in natural places. We'll be working with 6 cities, running 3 randomized controlled trials, pre-post studies. We'll be doing social network analysis to really look at the actors that are working at the intersection of loneliness and nature-based solutions. And the cities that we're working with are Melbourne and Cuenca outside of Europe, and then Helsinki, Prague, Marseille, and Barcelona. The project began in March 2021, and it is a 5-year initiative. What's crucial is that it provides an upstream solution that we will test to foster social connection and reduce loneliness. It is multi-component, it'll be behaviorally based, and it will promote embeddedness and belongingness in the community. Again, getting back to this original concept of loneliness and what are the antidotes to address it. What's crucial here is that the active intervention ingredients, so when we design our menu, when we design this intervention, we will make sure that people in a group-based intervention will be directly participating, so getting their hands dirty, nature contact and time outdoors, because we believe this will amplify the effect. And based on real data that informs this initiative, there'll be social support and social participation, essentially a social organization to help people move along in this intervention. Group facilitation, we feel like a designated lead is essential. This is, again, drawing on the evidence base of what works in community-based interventions. It is sensitive enough to be culturally tailored and context specific, which is crucial for promoting inclusiveness, equity, and diversity in these different kinds of intervention. We are going to be developing a nature-based social prescribing menu. We can include many different facets that have these ingredients, but some examples are gardens, rooftop gardens, community dance opportunities, cycling without age. So we hope with Reset This, we will provide a bridge between nature-based solutions in cities and the mental well-being of our communities in ways that are inclusive, equitable, and diverse. Thank you so much for your time, and I look forward to connecting